Dr. Campano, I've heard something about fillers. Can you talk about them?
Sure. You know how we talk about the 11s for Botox, which are those vertical lines here? We could talk about the parentheses for our nasolabial folds. When we age, the skin descends at an angle this way. So we develop that nasolabial fold. When they're on both sides, we call them the parentheses. And then underneath here, we also form the marionette lines. When light reflects off of a surface, we see that shadow. So the descent of the skin causes that ridge, the valley, if you will. And so we can diminish the appearance of the valley by filling it up. So we fill in that valley, and fillers are a great substitute. So instead of actually doing the lift, you can fill in that ridge and the surface looks smooth. And there's different types of fillers. Restylane is probably the most common one that people have heard about. And Juvederm is the newer filler that has come out, and it has great results as well. Basically, fillers are made of something called hyaluronic acid, and the Restylane lasts about 6 months. The Juvederm lasts about up to a year, sometimes a little bit longer for some people. And these are materials that are naturally made in the human body, hyaluronic acid. So it has been embedded into a gel-like substance, and I inject that underneath the surface of the skin to fill in that valley so that the skin is smooth in appearance. So you can take away those parentheses. There's another type of filler, and that's called Radiesse. It's made of calcium hydroxyapatite. It's a little bit of a thicker substance, so for a deeper wrinkle, I will put it in there. In addition, we can do fillers to different areas. We can do the non-surgical rhinoplasty, where I'll use that Radiesse to even out some irregularities on the nose, or if there is a deep acne blemish, I will go in, it's called subcising, where I use a needle to lift up that tissue and then fill up that divot with the filler.